Episode 8. What else determines how much you get paid? Welcome to Medicine, Dollars, and Decisions, Life and Business in Medicine. I'm Dr. Bruno Casanova. In this episode, we'll discuss the personal and professional factors that affect compensation, including experience, productivity, reputation, and negotiation power. So far, we have discussed several forces that influence compensation. We talked about the RUC. We talked about CMS. We talked about the conversion factor. We talked about geography, specialty differences, and MGMA benchmarks. But even after all of that, there are still other factors that determine how much you actually get paid. Because compensation is not based only on your specialty. It is not based only on your region. And it is not based only on how many RVUs Medicare assigns to a particular service. In many cases, the dollar amount an organization offers you per work RVU also depends on you, your experience, your history, your production, your reputation, your value to the organization. Let's start with experience. Imagine two physicians in the same specialty. They practice in the same city. They perform the same procedures. They may even work for the same institution. One is a recent graduate, fresh out of residency or fellowship, with limited independent practice experience and no significant professional history. The other has been practicing for 20 years, has extensive clinical and surgical experience, has built a reputation, and has managed the complexities of real-world practice, including prior malpractice or lawsuit experience. Even if both physicians generate RVUs in the same system, an employer may not offer them the same dollar amount per work RVU. Why? Because employers do not evaluate physicians only by RVU formulas. They also evaluate risk, reliability, efficiency, reputation, clinical maturity, and expected productivity. A recent graduate may be very talented, but the employer may still view that physician as someone who needs time to build volume, gain experience, develop referral patterns, and become fully efficient in practice. An experienced physician, on the other hand, may bring years of proven performance, established clinical judgment, stronger referral relationships, and a track record of handling complex cases. That history can influence compensation. Now, malpractice history can also play a role. A physician with prior lawsuits is not automatically disqualified from receiving a strong offer. In many specialties, especially surgical specialties, lawsuits are unfortunately part of the professional landscape. But employers may still consider that history when evaluating risk, malpractice premiums, credentialing, and overall contract terms. So experience and history matter. But there is another factor that may matter even more: productivity, especially how many work RVUs a physician produces in a year. Let's use a simple example. Imagine two physicians in the same specialty. They have the same years of experience. They have similar malpractice histories. They work in the same region. They may even work in the same hospital. Now let's assume that, according to MGMA, or similar benchmark data, the 75th percentile of production for that specialty in that region is 8,000 work RVUs per year. One physician produces 7,000 work RVUs per year. The other produces 12,000 work RVUs per year. These two physicians may have the same title, they may work in the same building, they may have the same specialty, but from the employer's perspective, they are not generating the same economic value. The physician producing 12,000 RVUs is producing far above the 75th percentile benchmark. That physician is not only generating more work RVUs, but is also contributing to additional revenue and clinical capacity for the organization. Remember, employers are not looking only at the work RVU portion. For many services, the institution may also consider practice expenses, malpractice costs, payer mix, facility resources, staffing needs, and overall service line economics. So when a physician produces more work RVUs, that production can create additional financial value for the institution beyond the physician's personal compensation. That is why organizations often try very hard to retain highly productive physicians. A high-producing physician may support the financial health of a department. They may help justify additional staff. They may increase surgical volume. They may help maintain service lines. They may attract referrals. They may reduce patient wait times. And they may generate revenue that supports other parts of the practice. Of course, higher productivity can also benefit the physician. A provider who consistently produces more RVUs may earn more through productivity bonuses. But that provider may also have stronger negotiating power. If an employer knows that you are consistently producing above the benchmark, you may be able to negotiate a higher dollar amount per work RVU, a better bonus structure, additional supporting staff, more operating room time, a leadership role, or other favorable contract terms. This is an important lesson for young physicians and advanced practice clinicians. Your compensation is not only determined when you sign your first contract. It can evolve over time. As you build experience, increase productivity, develop a reputation, and demonstrate your value to the organization, your negotiating position may change. But that also means you need to understand your numbers. You should know how many work RVUs you produce. You should know how your production compares with MGMA and other benchmark data. You should know whether your compensation is aligned with your productivity. And you should understand how your employer calculates bonuses, thresholds, and RVU conversion rates. Because without that information, it is very difficult to know whether your compensation is fair. Now, let's imagine a different situation. You're applying for a new job. It is your ideal practice. The location is perfect. The work environment seems supportive. The schedule fits your life. The physicians are welcoming. The leadership team likes you. You love the practice, they love you. It feels like a match. Congratulations. But now comes the question that many physicians find uncomfortable. How much are you going to get paid? And more importantly, how do you know whether the offer is fair? In the next episode, we will discuss how the physician job market affects compensation and why supply and demand can change the value of your work more than many doctors realize. This episode is for informational and educational purposes only and does not constitute financial, legal, tax, investment, contract, coding, billing, or medical business advice. Listeners should consult qualified professionals regarding their individual financial, legal, tax, employment, contract, coding, billing, and medical business decisions.